I'm Marit de Vries. I'm a human geographer by education, and I work at the National Institute of Public Health and the Environment in the Netherlands. So we are doing scenario studies within the BlueHealth project because we want to understand more of the interactions between water and health now, but also in the future. So what to expect in the coming decades. And we're thinking about a period of time until 2040. Demographic projections and environmental studies allow us to kind of have a peek into the future, what will happen. But for example, technological advances or what will happen, I don't know, with in more socio-cultural developments, is very difficult to get a grip on it, and you can't really make projections. So for that part of scenario studies, we have a more qualitative approach, and we work with experts and expert workshops. We actually organize expert workshops in different cities within the BlueHealth project. We try to invite as many people from as many different backgrounds as possible. So people with more policy backgrounds, people with economic knowledge, maybe from economic sectors that are important in the city where the expert workshop is taking place, academics, environmentalists, people who work in, for example, water research or water authorities that are active within the city that we're working. Well, the idea is that the experts within these workshops share with us their knowledge on what the future might bring. We never can know for sure, but it's more a qualitative approach to what it might bring. And we also want to share, or we also ask them to share with us what they think are the most important values or norms that are applicable to this certain locality. For example, we did a workshop in Amsterdam, and two of the values that seemed to be very important were economic vitality and water awareness, or at least the developments in the city related to water, for example, the expectations of more flooding and heavy rainfall. And social equity, that was also one that was very important. Well, maybe for other cities, we don't know yet. There might be other values that are more important for policymakers to take into account. The way in which we want to disseminate all the information that we're gathering is by creating different narratives. The idea of these narratives is that they're kind of stories from the cities where the more normative aspects also get a place. And the different cities stand for different types of localities. And the idea is that from the different narratives you can take the parts that are applicable to whatever the kind of decisions you want to, or you have to be making as a policymaker, for example.